Okay, I'm doing a video presentation for Module 6 in our assignment. The topic is medication noncompliance. I'm going to be reading and talking about, there's about 4 questions that I'm going to be answering, and so I'll move on. The first question that the assignment calls for is, what is medication noncompliance? And excuse me. Medication noncompliance is basically failure or refusal to comply. In medicine, the term noncompliance is commonly used in regard to a patient or client who does not take a prescribed medication or follow the prescribed course of treatment. A person who demonstrates noncompliance is said to be noncompliant. There's a lot of reasons for noncompliance. Data shows about 1/4 of new prescriptions are never filled. And patients do not take their medications about 50% of the time. Most noncompliance is intentional, and patients make rational decisions not to take their medication based on their own knowledge. The top 8 reasons for intentional noncompliance are: number 1, fear; number 2, cost; number 3, misunderstanding; number 4 is too many medications; number 5 is lack of symptoms; number 6 is worry; number 7 is depression; and number 8 is mistrust. And I'll just read a couple of the explanations for these 8. Fear: patients may be frightened of potential side effects. They may have witnessed side effects experienced by someone else and afraid that it'll happen to themselves. Misunderstanding: clients or patients may not understand the need for the medicine, the nature of the side effects, or the time in which they will see results. And I've seen this a lot with people who suffer from mental health problems. The prescription, the medication they're prescribed, they need to be taken. They need to take it from sometimes 2, 3, 4 weeks before the medicine actually starts doing anything, or they feel any different from taking it. So and so they just get frustrated and they stop taking it. Lack of symptoms: patients and clients who do not feel any differently when they start or stop taking a medication might see no reason to take it. Worry: concerns about becoming dependent on medication. And mistrust: clients or patients who are suspicious of the doctor's motives for prescribing certain medications because of recent news coverage or marketing efforts by pharmaceutical companies. So there's just a lot of reasons why people might not be compliant in taking their medications. The next question is, what are the risks involved with noncompliance? Well, there's a lot of risk. We're talking about your health here. Doctors typically don't prescribe medications just for the fun or the heck of it. The risk could be deteriorating health. You're not going to get any better if you're supposed to be taking antibiotics because of something going on inside your body and you don't take them. It's obviously not going to heal. If you're taking some kind of psychotropic medication, you're obviously, if you're taking it for depression, you're taking it for schizophrenia, or you're taking it for whatever reason, you're simply not going to get any better, and the risk of you slipping deeper into depression, or your schizophrenia, or your bipolar disorder getting worse, could be a bad thing for you. So there's just a lot of risk involved. And the last question is strategies for addressing noncompliance with clients. Strategies for addressing noncompliance. Various methods have been reported, and are in use to measure adherence. The methods available for measuring adherence can be broken down into direct and indirect methods of measurement. Direct methods can include observed therapy, measurement of the level of the drug or its metabolite in blood or in urine. You could do testing. Direct approaches. Direct approaches are the most accurate methods of measuring adherence, but are more expensive. Moreover, variations in metabolism and white coat adherence can give a false impression of adherence. Indirect methods include patient questionnaires, patient self-reports, pill counts, rates of prescription refills, assessments of patients' clinical response, electronic medication monitors, measurement of psychologic markers, and as well as patient diaries. Each method has its own advantages and disadvantages, and no method is considered as the gold standard. Assessing children's adherence can be done by asking the help of a caregiver, school nurse, teacher, among other various methods, questioning the client, client diaries, and assessment of clinical response are all methods that are easy to use. But questioning the client can be susceptible to misrepresentation and tends to result in the healthcare provider overestimating the client's adherence. So there's a lot of different ways that we can monitor client adherence to taking medications, and I think too that they're just by observing and spending time with the client, especially when we're talking about psych meds, we can pay attention to that, pay attention to our clients, and really we can almost see whether they're taking them as prescribed. So that's my presentation, and thank you very much.